The medical problems of the ancient Egyptians stemmed directly from their environment. Living and working close to the Nile brought hazards from malaria and debilitating schistosomiasis parasites, which caused liver and intestinal damage. Dangerous wildlife such as crocodiles and hippos were also a common threat. The lifelong labors of farming and building put stress on the spine and joints. And traumatic injuries from construction and warfare all took a significant toll on the body. The grit and sand from stone ground flour abraded teeth, leaving them susceptible to abscesses. Though caries were rare, the diets of the wealthy were rich in sugars, which promoted periodontal disease. Despite the flattering physiques portrayed on tomb walls, the overweight mummies of many of the upper class show the effects of a life of overindulgence. Adult life expectancy was about 35 for men and 30 for women. But reaching adulthood was difficult as about one-third of the population died in infancy. Ancient Egyptian physicians were renowned in the ancient Near East for their healing skills. And some, such as Imhotep, remained famous long after their deaths. Herodotus remarked that there was a high degree of specialization among Egyptian physicians, with some treating only the head or the stomach, while others were eye doctors and dentists. Training of physicians took place at the Parank or House of Life institution, most notably those headquartered in Per-Bastet during the New Kingdom and at Abydos and Sais in the late period. Medical papyri show empirical knowledge of anatomy, injuries, and practical treatments. Wounds were treated by bandaging with raw meat, white linen, sutures, nets, pads, and swabs soaked with honey to prevent infection, while opium, thyme, and belladonna were used to relieve pain. The earliest records of burn treatment describe burn dressings that use the milk from mothers of male babies. Prayers were made to the goddess Isis. Moldy bread, honey, and copper salts were also used to prevent infection from dirt in burns. Garlic and onions were used regularly to promote good health and were thought to relieve asthma symptoms. Ancient Egyptian surgeons stitched wounds, set broken bones, and amputated diseased limbs. But they recognized that some injuries were so serious that they could only make the patient comfortable until death occurred.